Good morning, all. Welcome to our interesting topic on occupational health practice in Kenya. We thank all the participants who managed to join, and I want to pass it over to our able doctor and give her the opportunity to introduce herself and also pick it up from there. Over to you, Doc.
Thank you, Anthony, and thank you and everyone again for attending this session. My name is Dr. Njuguna. I'm a general practitioner and a DOSH certified health practitioner. So I'm going to take us through this topic, occupational health practice in Kenya. And the scope of this presentation is as shown. I'll give a few definitions, a bit of history on where occupational health came from and how it started, the relationship between health and work. I will introduce a concept called employee wellness programs and explain a bit about that, its benefits both to the employee and to the company. Then we'll look at occupational hazards and diseases, and we'll end with looking at Kenya labor laws, what we have in place in this country, and then we'll conclude. So allow me to begin with some definitions. Most importantly is what is the definition of health? We think we know the definition of health, but the actual definition according to WHO is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And what is wellness? Wellness is an active process of becoming aware of and making choices towards a healthy lifestyle. Wellness is not just being free from illness. It's a dynamic process of growth and change. What is work? Work is any activity where one is exerting their strengths or faculties to do a task, and an activity that a person is engaging in regularly, most of the time to earn a livelihood. Employment is a relationship between two parties, usually based on a contract where work is being paid for. One party is like a corporation, profit or non-for-profit, cooperative or any other entity, and that is the employer, and then the other is the employee. So what is occupational health? This is a branch of medicine that deals with health of people in relation to their workplace and the prevention and management of work-related injuries and illnesses. To give a more comprehensive definition of occupational health, I want to show you the ILO definition, which states that occupational health is the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations by preventing departures from health, controlling risks, and the adaptation of work to people and people to their jobs. So this definition was adopted in 1950 during the first joint ILO WHO committee session, and it was revised in the 12th session in 1995. Just a few additions. I think it's the fourth bullet there, the placing and maintenance of the worker in an occupational environment adapted to his or her physiological and psychological capabilities. So from definition, we can look a bit on history and a bit of history with occupational health and medicine. We have who was Bernardino Ramazzini, who was considered the father of occupational medicine. He was around in the 18th century. He was the first physician to recommend that asking about a person's trade should be included in all medical history taking. He also wrote a book describing different occupational diseases. The book was called De Morbis Atypicam Diatriba. So when did occupational health become of importance? How did it start? We'd have to answer that question, we have to go back all the way to the Industrial Revolution, which happened in 1760 to the 1800s. So before 1760, agriculture and the making of products was done from home. And then came a rise of development in machinery and improvement in manufacturing processes, which led to the opening of factories. This caused people to flock to the cities, to work in the mills and the factories in the towns. The vast number of people working in this, looking for work, led to poor pay, long work hours, very hazardous factory conditions, and an increase in child labor. Children were made to work as young as 4 years old and over 12 hours a day. They were used to climb, because of their small size, were used to climb into the machine, under the machinery, which resulted in loss of limbs, decapitations, crash injuries, and a lack of any health and safety also meant that children developed occupational diseases at a very young age, such as lung cancer. They would die as early as 25. Phossy jaw from phosphorus fumes. Phossy jaw is necrosis of the jaw due to phosphorus deposits in the jaw. Children employed at glassworks, they would get burnt, blinded, because of no protective gear, and exposure to poisonous clay dust at potteries would lead to lung conditions. Just to show you how this actually looked like, these are some images of the children working in the factories, and you can see there's absolutely no protective gear, no shoes, no protective gloves, no clothing, no protective eyewear, and these children look very, very young. So this is one of the major situations and major issues that now caused an outcry, that led to people to question what, health and how safe are our factories for people. So this led now to, in the UK, in 1803, they developed the Factory Act, and later in 1835, they had the duty of care over the obligation of duty of care over one's employees. In 1974, the Health and Safety at Work Act was passed in the UK. The act led to the establishment of the Health and Safety Executive, HSE, which is the governing body in the UK on all matters health and safety. In 1970, in the United States, they enacted the OSH Act, and this led to the establishment of OSHA, the Occupational Safety and Health Administration, which passes health and safety standards and is involved in their implementation and enforcement, as well as the National Institute of Occupational Safety and Health, which acts as a research body. In Kenya, where have we come from? In 1950, Kenya established the Factories Act. In 1990, the act was amended to the Factory and Other Places of Work Act, and then it was then repealed in 2007. Now we have the OSH Act and the Work Injury Benefits Act. Both these laws are administered by the Directorate of Occupational Safety and Health Services, or DOSH. So a bit about the global burden. So the International Labour Organization estimates that 2.3 million women and men around the world succumb to work-related accidents or diseases every year. This corresponds to about 6,000 deaths every day. Worldwide, there are 340 million occupational accidents and 160 million victims of work-related illnesses annually. So how is health and work related? That's what I want us to look at, and we'll look at it in two perspectives. The first is the health and fitness of the worker. How healthy is the worker, and how does this affect their performance and their productivity in their work? And then we look at the work itself, the work environment, the work duties, and what kind of hazards they have that would be detrimental or negatively affect the health of a worker. So what is the relationship between health and work? I'm sure we have all seen it in ourselves and seen it in people around us. When somebody gets a job, their health and well-being improves. You notice there is a boost in their self-confidence, self-esteem. They have a sense of purpose, something to wake up in the morning to go and do, and it also rewards one financially and puts them in a better socioeconomic situations. Studies show that an employee can spend up to 80% of their waking hours at their place of employment. Therefore, this means that an employee's workplace contributes greatly to their health, and likewise, their health will significantly impact the quality of their work. It's been found in many studies that healthy employees have been found to have improved productivity and performance. They have a better attitude towards their work and better relationships with their co-workers and senior management. There's an epidemic of lifestyle diseases, and this has developed globally with poor unhealthy lifestyles, which include inactivity, poor nutrition, tobacco use, alcohol consumption, and very high stress levels. Lifestyle diseases have shown a marked increase in the working age population, which means this adds to the economic burden through a rise in illness-related loss of productivity due to absence from work, absenteeism, or reduced performance while at work, which is called presenteeism. This greatly impacts employee health and well-being, and thus raises cost of healthcare coverage. So in response, employers are adopting health promotion and disease prevention strategies, which are called employee wellness programs. So now I just want to highlight some studies that have been done in some of our first world countries, where they have looked at these wellness programs and tried to assess what is the effect of them towards the health of the workers. So the studies I'm going to show briefly these are Australian studies. They were done by Medibank Private. This is one of the largest private insurance companies in Australia. The first study they did, they took over 3,000 employees from corporate and small business Australia, and they assessed them and assessed to see what is health and how is their health affecting their work. They found that 143 effective hours per month is what a healthy employee can give, versus only 49 effective hours per month from the least healthy employee. An employee with poor health behaviors had 9 times more likely the sickness absence of a healthy employee. This came to about 8 days compared to 2 days per year. Studies assessing effect of wellness programs on performance. Companies without wellness programs were 4 times more likely to lose talent in the next 12 months. Companies and institutions and organizations with a wellness program, the percentage of engaged employees increased from 7 up to 55%. Creativity and innovation increased from 20 to up to 72%. A different study where they looked at presenteeism. Like I said, presenteeism is when an employee is at work, but they're not performing their duties. So they found that the cost of presenteeism to business is almost 4 times that of absenteeism. The average productivity loss per employee is about 2.54%, which equates to about 6 working days per employee per year. The main causes: depression, allergies, hypertension, diabetes, stress, all contributors to presenteeism. I want to highlight another important study. This is called the RAN study, done in 2013 in America. It is one of the most rigorous and comprehensive studies on employee wellness programs so far that has been done. And how they went about this study, they employed 4 different analysis and collection streams. They reviewed scientific and trade literature. They did a national survey of employers. They did a longitudinal analysis of medical claims and wellness program data from a sample of employers. And they took 5 case studies of existing wellness programs in a diverse set of employers to gauge the effectiveness of these programs. What did they find? There was statistically significant and clinically meaningful improvements in exercise frequency, smoking behavior, and weight control. These improvements were actually found to be sustainable over a period of 4 years. 1 year participation in a weight control program was found to lead to reduction of body mass index of about 0.15 in the same year, and this effect persisted for 2 subsequent years. So in conclusion, employers expressed overwhelming confidence that these wellness programs have a positive effect. They reduce medical costs, reduce absenteeism, and health-related productivity losses. The workplace programs are therefore what can help therefore to contain the epidemic of lifestyle diseases and the main driver, which is the main driver of premature morbidity and mortality in the United States. So what are the components that can be in a wellness program? These programs can be tailored. They are, they can be tailored to a specific organization's needs, to their specific work setup and all this. So some of the components that can be there are health risk assessments or surveys, clinical screenings or examinations with focused investigations, nutrition and fitness programs supporting employees on their diet and physical fitness practices. Lactation program, this is simply assisting and supporting breastfeeding mothers. Ergonomic screening. Ergonomics is in occupational health. It is basically looking at the physical body and its orientation while you're doing your work. Are you sitting in a comfortable chair? Are you sitting in an awkward position? Are you standing throughout your work? Are you in your physical body? Is it in any way under strain while you're doing your work? And then how can that be improved? So that is what we would do. We would look at when doing an ergonomic screen. Psychometric testing, this is like a personality test where you assess your employees based on their individual personalities, and having this information helps an employer or a supervisor to be able to tailor or support an employee in terms of performing how to best perform their tasks, how to assign tasks, and how to evaluate the productivity and performance of an individual based on their individual personalities and capabilities. Then we have smoking cessation and Alcoholics Anonymous, stress management and mental health screening, which is a big concern, a growing concern in the workplace. So what are the benefits that come to the employee from having these programs? There's increased productivity in all areas, both work and personal life, improved health behavior and health-seeking behavior, increased creativity and innovation, employee confidence and sense of belonging is boosted, employee motivation and resilience, there's reduction in absenteeism and sick leaves, and presenteeism, which leads to an increased engagement at work. What are the benefits to the company? Most CEOs always ask what is the bottom line when you present something like this to them, and what this does for companies improves employee productivity and performance. It increases employee engagement, reduces staff turnover, which is a cost, has cost implications, reduced compensation claims, and reduced employer-sponsored health insurance costs. I want to highlight two other studies just to show what is the economic benefit of having these programs. These are two different large meta-analyses that were done to assess worksite health promotion and its economic return. So the first study found that a decrease in sick leave absenteeism was by 25.3%. This happened due to employee wellness programs, decreased worker compensation by 40%, decreased disability management costs by 24%, and a savings of $5.81 for every $1 invested in an employee health and wellness program. A different meta-analysis that looked at the same found that was on cost and savings that are made by having employee wellness programs. They found that medical costs can fall by $3.27 and absenteeism costs by $2.73 for every dollar that was spent on the wellness program. So we've looked at it from the health of the employee and how that can impact their work. So we'll now look at the second perspective, which is the work itself. What is actually being done? What are the hazards in place? And how can that affect the employee? So I'm just going to give you a classification of occupational hazards that you can have. So the first is biological. Biological is any substance that causes harm to human health when someone is exposed to it: bacteria, viruses, fungi, insects, animals, other humans, and the effect can be allergenic, irritant, infectious, or carcinogenic. Chemical, these are any chemicals that have a negative health effect, either corrosive, irritant, carcinogenic. And toxins can be neurotoxic, which is toxic to the nervous system. Nephrotoxic is toxic to the kidneys. And hepatotoxic, this is toxic to the liver. Then we have physical hazards. These include radiation, vibration, noise, heat, cold, pressure, and light, among others. Then we have mechanical. This occurs when any part of the body comes in contact with a part of a moving machinery, which includes crushing, shearing, entanglement, cutting, friction, abrasion, and others. And then we have psychosocial hazards. These are factors that affect the psychological health of a worker: workplace violence, bullying, harassment, stress, and burnout. So this is just a list of some of the occupational diseases that we can encounter. The first being zoonotic diseases. This is due to contact with animals, animal carcasses, bodily fluids, and veterinary work. Then we have bloodborne and airborne diseases. This is through direct or indirect human contact. This would apply more so to healthcare workers due to their interaction with patients. Pneumoconiosis. Pneumoconiosis is a chronic lung disease that occurs due to long-term exposure to inorganic dust particles. These dust particles go and settle in the airways and cause fibrotic changes. These changes lead to a reduction in the lung capacity, and thus affect the lung's ability to function properly. Most common of these, asbestos, silicosis, some of the examples, and anthracosis. Then we have sensorineural hearing loss or noise-induced hearing loss, and acoustic shock syndrome. Acoustic shock syndrome is simply a syndrome of symptoms that develop after somebody is exposed to a very large sound like a bomb or explosion. They're at risk of developing this syndrome. Poisoning, they can be poisoning due to very many different chemicals. These are just some of them: cadmium, benzene, iron, lead, organophosphates, magnesium, manganese, and mercury. Ionizing radiation, against this tends to be seen in the healthcare sector, most with some of the in our radiology departments, and we have and there are some systems, things in place that to help to protect workers in the radiology department against this. Decompression sickness, this is mainly for divers and submarine workers. Ergonomic diseases, carpal tunnel syndrome, hand vibration syndrome, low back pain, all conditions that develop due to poor ergonomics. And we have also eye diseases, toxic amblyopias, optic neuritis, arc eye, which happens mainly in welders if they don't use the protective or don't have available the right protective eyewear. So what do we have in this country? What is in place for us when it comes to occupational health and safety? We have, as I mentioned before, we have the Occupational Safety and Health Act of 2007. We have the Work Injury Benefits Act of 2007, which stipulates compensation and how that can be done for any workplace injury and disease that occurs in a workplace. Then under the OSH Act, we have 13 subsidiary legislation. For purposes of this presentation, I've just listed the 3 important ones, most important being medical examination rules. We also have the Noise Prevention and Control rules and the Factory and Other Places of Work Act for hazardous substances. So this is just a section of the Occupational Safety and Health Act that I wanted to highlight. It's section 103, which deals with medical surveillance. This section of the Act gives the minister a right to develop regulations requiring medical surveillance and examinations if there's any concern regarding the workplace and any negative effect due to the workplace and occupational hazards in the workplace. So what the minister is able to do, they are if they're satisfied the work has a risk to the employees, they are permitted to make rules requiring medical examination of the employees, both at a pre-employment, annual and post-employment stage, and regular or individual examinations or surveys of health conditions from a point of view of industrial medicine and industrial hygiene. Of note, the cost of these examinations are referred to in subsection 3, and they shall be paid by the employer. They are to be conducted without any loss of earnings to the employees, and if possible, within working hours during their employment. This section at the bottom also says that a person who contravenes, or an institution that contravenes these provisions set in place, commits an offense and shall, on conviction, be liable to a fine or even imprisonment. So this slide is just a snippet also from the subsidiary legislation, which is the medical examinations rules. This is particularly schedule, the first schedule. I just wanted to highlight what some of the work risks that are listed there. There's a whole list which one can look at their own time, but I just wanted to show some of them. The top being, if you're handling animal products, animal carcasses, somebody in that workplace would require clinical examination at a pre-employment and annual level. And any cases of definite or suspected zoonotic diseases would be an indication for redeployment. Redeployment means this employee must be replaced somewhere else away from the hazard. And then we have work with arsenic, and the requirements are there. You need to do your clinical examinations, estimate urine arsenic content, do a full size chest X-ray, sputum cytology. This is both at a pre-employment and annual for all. And any indications for redeployment, any cases of definite or suspected arsenic poisoning, any case where urine arsenic levels are found to be 500 micrograms per liter in 2 successive examinations, and all cases with evidence of cancer. Ionizing radiation, another important issue. For this, clinical examination is necessary, pre-employment and on an annual basis. Any abnormal visual or clinical signs would be an indication for redeployment of that employee. Then we have noise, another very important one. So for this audiometric examination at a pre-employment and annual level, and any cases of definite or suspected noise-induced deafness would be an indication for redeploying this employee. Asbestos, very common cause of the pneumoconiosis that I mentioned. So for this, if there is any exposure to asbestos, clinical examination, lung function tests, full-size chest X-ray and sputum cytology is necessary at a pre-employment and annual level. And any symptomatic worker, any worker with progressive deterioration of chest X-ray findings would be a candidate for redeployment according to the schedule. So this is a snippet of the noise prevention and control rules. Noise is very important, and so I just wanted us to show briefly what are some of the permissible noise levels and what is necessary. So any worker who is continuously exposed to more than 90 decibels in an 8-hour shift within a 24-hour period, or a worker who is exposed to 140 decibels at any given time in the course of a 24-hour period is if any workers are under any of these two conditions, then the organization or the company is obligated to establish a noise prevention program. At the bottom there, you'll see some of the components that are required in this program. We need to have noise measurements done. There needs to be education and training. There needs to be engineering noise controls, so that at the best of the ability of the machine should be working with when producing minimum noise. Hearing protection needs to be provided. Posting of notices in these noisy areas, hearing tests, and an annual review of this program is necessary. So what is DOSH? As I mentioned, the DOSH is the Directorate of Occupational Safety and Health. It's under the Ministry of Labor and Social Protection. It is in the body that is in charge of implementing the OSH Act and the Worker Compensation Acts, Worker Compensation under the WIBA Act of 2007. They also are in charge of workplace inspection and implementation of the National Occupational Health and Safety and Health Policy of 2012. So DOSH also approves individuals through certification to perform duties on their behalf and report their findings and recommendations back to DOSH. So approved individuals include air quality monitors, OSH advisors, OSH trainers, fire safety inspectors, and designated health practitioners. So that a designated health practitioner is explained and is present in the medical examination rules, which one can read at their own time. But what a DHP does is we are medical doctors licensed by the director of DOSH to conduct medical examinations at workplaces on their behalf. We provide a report to the director with findings and recommendations regarding the health of the staff in that organization. This is guided under the medical examination rules subsidiary legislation, like I said, and it basically stipulates the role of a DHP and the list of medical examinations required based on the hazards that a worker is exposed to and how often these examinations should be done. So that is my presentation on this topic. That's myself, Dr. Njuguna. My contacts are there, or they are also available on the DOSH website if you would want to reach out to me for any further queries or discussions regarding OH practice. I also shall be offering a clinic, occupational health and safety clinic at the Aga Khan Hospital, Mombasa. I should be offering it at the main hospital on Wednesdays between 9 to 12 and Nyali Medical Center on Tuesdays 9 to 1. I also will be offering the clinic on an appointment basis at Changamwe, the Changamwe branch. And in this clinic, we'll be offering medical examinations, basically supporting corporates in enhancing their compliance. And what will be included in these examinations is medical examinations, spirometry or geometry is available, laboratory and radiology screens as necessary, visual tests, and support on nutrition, physical fitness, counseling of the employees, and any other support that a corporate may require. They can always reach out and we'll see how to support them. If there are any queries, questions, we have the contacts down there, which you can reach out to Aga Khan, and we can always support in any way. So thank you. If there are any queries, you can reach out. I've shared the contacts, and I'll be happy to answer any queries and questions. Thank you.
Thank you, Dr. Ann. I'm seeing there's lots and lots of questions that have been asked by the audience. To our audience, once again, thank you for joining. Um, the contacts are, as you've seen, on the last slide. Um, over to the question and answer session.